Morning everyone. I'll be reporting a case. Actually it is not atypical also. It is suspected optic neuritis following ATT. I am presenting a case who was 44-year-old male who is a teacher by profession and came to our OPD on last year in the month of December, and his chief complaints were sudden diminution of vision in both eyes for last 1 week. It was associated with dull pain. Initially, he observed blurring of vision in one eye, which was followed by involvement of other eye also within 2 days. Diminution of vision was gradually deteriorating. The past history of the patient is very significant. He's a known diabetic for past 10 years, and he had a bout of hemoptysis. And within 10 months, he had 2 bouts for which he was investigated. The right lung upper lobe cavitational lesion was diagnosed in June 23, for which the specimen was taken from wedge of the right upper lobe, and on histopathological examination, the specimen did not reveal anything related to tuberculosis, and there was no evidence of malignancy also. But he was diagnosed as necrotizing granulomatous inflammation of the lung, and for this he was put on ATT as per the DOTS regime. The patient is also on oral hypoglycemic drugs, and once he was put on this oral ATT for his lung lesion, though none of the investigations revealed that he had tuberculosis, which he continued till 20th of December last year, but he developed these visual symptoms on about 10th of December last year. But still he continued with the treatment because he was told to continue it for 6 months. When he presented to our OPD, on examination, his visual acuity in the right eye was 6/36, whereas in the left, he had dropped to 6/24 part, and this was the best corrected visual acuity. Extraocular movements were slightly painful. Color vision, he had red-green hue defection, defective color vision, and the contrast sensitivity was also slightly reduced. Anterior segment examination revealed he had a nuclear sclerosis of grade 2 with blue dot cataract in both the eyes, and intraocular pressure with the AT was 14 and 16 millimeter in both the eyes respectively. Fundus examination revealed hyperemic disc and tortuous vessel, and he had background diabetic retinopathy in left eye. Investigations like OCT, optic nerve head, retinal nerve fiber, which was performed, were inconclusive. MRI brain with orbits was done, and it suggested small vessel disease indicating ischemic insults. His vision continued to drop till it was 2/16 both the eyes, and he was advised other investigations also like B12, TSH, NMO, and MyOG antibodies to rule out any autoimmune pathology, calcium, phosphorus, ALP, SGPT, lipid profile, urea creatinine, etc. ESR was also on higher side. So it was around 48 millimeters first hour. Blood sugar fasting and postprandial was within normal range, slightly on higher side. So the serum triglycerides were on higher side, and rest all the investigations were found to be within normal limits. There was no NMO or MOG antibodies found. These are the OCT pictures of the same patient, which were performed at frequent intervals, and they were almost inconclusive on different durations of his illness. And then he was put on treatment once he did not improve, even around 6 weeks after the stoppage of anti-tubercular drugs, and he continued, his vision continued to drop till it was 2/60, and after performing all these investigations, we started him on pulse steroid therapy. That is IV soluble Medrol 500 milligram for 5 days. He was put on IV, then it was tapered, and he was put on oral Visolone tablets 40 milligram, 30, 20, 10, and 5. And when the duration of this oral steroid treatment was continuing, he was simultaneously he was put on injection insulin also to take care of his hyperglycemic status. And once the treatment was started, his vision started to improve, and by the end of 3 months, his vision was around 6/9 parts, best corrected in both the eyes. Intraocular pressure and other details were within normal limits. So the provisional diagnosis of atypical optic neuritis was made. But there was a sudden twist in this patient. He used to come for regular follow-up, and once he came for follow-up last month, his vision, though his vision was, best corrected vision was still on 6/9, but his intraocular pressure was on higher side in both the eyes, and fundus examination revealed temporal disc pallor. Perimetry was normal, and follow-up OCT also revealed temporal thinning and retinal nerve fiber thinning also. And after this, now the patient has been put on anti-glaucoma therapy. This is the picture which is recently done at 6-month follow-up, OCT revealing temporal thinning. So these are the references, though I have labeled him as atypical optic neuritis, but still I am not sure about the correct diagnosis in this patient. Thank you.
OCT, nice presentation.
Thank you.
OCT macula you didn't do?
That is normal, that we did,
That
but
was
I have
normal.
not presented the pictures here.
And field test you should have presented also.
Actually, I was not able to upload that at the last moment. That is also normal. I have seen
From the beginning it was normal.
Yeah. Perimetry throughout has been normal. Only we have been following
Vision
him.
was reduced so much,
Yeah.
can't be normal.
Yeah. No. That time it was not done, but regular follow-up once his vision started improving. When, as I told you, he was on steroid, and all these tests were within normal limit. But once he came for follow-up at his around 6 months, this
It was
OCT.
normal. So,
Yeah.
Okay. What was the reason typical neuritis? Cause what do you feel?
Previously, we thought it maybe perhaps because of ATT, especially ethambutol. But since he has developed this optic, this disc pallor also, he's going, the shift is towards glaucoma now. So it may be some other causes of optic neuritis, which is even not fitting into atypical type. So we are planning.
Patient has ATT, you are saying, so ethambutol, how long was he on ethambutol? So
He was on 6 months, even though he started with visual symptoms, but he did not stop because he was told by those lung people where he had got those investigations for his lung biopsy and all done. They had told him not to stop before 6 months.
Okay.
So even though he developed visual symptoms, he did not stop that.
So can it be a ethambutol toxicity which you saw
Yeah,
in
that
this?
is what I told you. We did
yeah.
not start him on pulse steroid till 4 to 6 weeks. We waited after stopping ethambutol and other ATT drugs, and we waited that perhaps if it is due to ATT, his vision should have improved. But on the contrary, it further fell to around 260 in both the eyes. So
Because
after that,
ethambutol toxicity is always there, so there will be a fall in the initial visual in those cases. So
But that is what I told you, ma'am. Initially, we did not put him on oral steroids. We waited for some time, but still, when the vision started to deteriorate after that, also it deteriorated to 2/60. At that point of time, after getting all those investigations, and we tried to rule out neuromyelitis and other autoimmune optic neuropathies, and then we put him on.
did you do MOG and all in this stage
Yeah, I have
also
referred to that,
associated?
ma'am. They were all normal.
All normal. Okay.
Okay, thank you.
Thank you.
Nice presentation.